Let's wait. Hi Kirti, hi Ajay, hi Shivan. I hope I said your name right. Hi Isha, hi Johida, hi Jitinder, hi Marjorie, hi Gabby, hi everyone. Welcome to the class. Let's wait few more minutes and I'll start giving you the complete overview of the program again. Hi Rafaela, hi Nikita, hi Preet, hi Rosna, good evening. Hi Gaia, that's Gayatri, right? Hi Mubaraka, hi Priyanka, Amit, hi Gulale, hi Deepika, hello Sirat, hi Manshi, hi Bhargavi. Yes, Priyanka, today we officially begin the week one, day one. Hi Rumana, hi Charu, hello Maria, hi Samina. Let's wait few more minutes. Hi Muskan. More people are still joining in on Facebook and here also. So let's just wait a few more minutes. Hello Shivani. Hi Maria. Hi Purva, Jinal. Hi Muskan. Hello Nitya. Hi Dyuti. Hi Divya, good evening. Hi Sadia. Hi Raman. Hi Tashu. Hi Raman. Hi Vishal Aditi. So first of all, guys, I would like to begin the session by sharing the greatest news with you all that the September results are out, and I want to congratulate again all the September graduates who cleared the Part 1 examination. We know that this batch also has been given a very tight and stringent pass rates by the ADC Part 1. So yet again, like your September 24 exam, the pass results, the pass rates were really low. But we have always been, Winspert has always been so transparent with our results that we always release the entire candidate list by giving the authentic names, the authentic screenshots from our WhatsApp group. And we stand by and we take extreme pride in the fact that we have never inflated our results. And with God's grace, even in September 24, when the results were the thinnest, and even same like September 25 this time, when the results have been thinnest, we have been blessed with the maximum past candidates in the entire ADC community, in the entire other ADC academies. And that is extremely a proud moment for me and my team and Winspert, that see, no matter how many students we have, of course we would want all of them to clear, but practically we also know that the pass rates, of course, will not be like everybody who takes the exam will crack it. But still, we take that pride that at Winspert, we create the maximum number of winners who crack the examination. So, whatever the total pass rate is, the maximum number of candidates, the most number of candidates, and the highest pass rates always and always belongs to Winspert. So, that is an extreme proud moment for I and my team that we can contribute to our candidates' success. And if you had attended our success celebration, we did talk about with the winners that how the success transpired, how the preparation translated to the success, how even if the familiar questions came in the exam, how the trickiness of the questions, the language issue, and the variations got a lot of students. So I will be covering in today's session a very important aspect of how to increase the grades of the students, especially those who have most A's and B's, like three pass grades but only one failing grade, so that C how to convert to B, right? That is a game changing grade situation, right? So I will be bringing a session also very soon where we will talk about how to convert your C grade to B grade. And we are also bringing for at Winspert a personalized strategic call with all our candidates based on their scores, so we can help them from the first week itself in elevating their grades and their percentage scores from 50 to 60, 70 to 80. Likewise, so we will start our inner circle consultation calls and strategic calls with our students to help them elevate their scores, right? So because you know that the pass rates we give out is always the most authentic. See, exactly, Sadia, we cannot know unless the report comes out what was the exact pass rate, but it was extremely lean compared to your, just like your September 24 examination, Sadia. So again, the very little less number of candidates passed, but out of that, 100 plus candidates belonged from the Winspert, and none of the other academies had that number of. I know some academies have posted their numbers and everything, but I can vouch for that they would not never be able to back it up with names, legit authentic candidate names, whereas we provide the authentic names, the authentic screenshots, and our candidates post all their results on the group, our official group. So that is the most authentic result that we release at Winspert. So still in the entire ADC community, maximum passes and the most passes, highest passes are always from Winspert. And I never claim that we have 90% of the pass. Of course, that's unreal, right? Even ADC doesn't have 90% of the pass. When I published, it was 90 plus candidates, and now after receiving more names, we are 100 plus candidates that have cleared with us. I think total 150 also did not pass. So if out of the total passes of ADC, 100 is from Winspert, that goes out to speak volumes about our material content and the preparation and the support system that we provide to our candidates. So I never claim in percentage 90% or something like that. Never. We always release the authentic names, the official list with full transparency. We never hide anything. We never, mask anything from our candidates, because we want to help them in the most honest way. And we tell them this is how the system works. These are the challenges, and this is how you can prepare to overcome those challenges. And we are holding your hands and we are providing you the best guidance, right? So total, I think maybe about 2,000 people appeared, Seher. We don't know unless ADC releases the report. Nobody can say how many people appeared, 1,500 appeared or 1,400 appeared. We don't know. That is why I'm saying we cannot get the statistics unless the report comes out. But total, if you check out everywhere, 100 plus candidates are from Winspert who passed. And if you go out and check other academies results, they don't have even 15, 20 legit names to put out there. That's what I'm saying, and that's what I'm comparing here. How many students took it? What was the pass rate of ADC? Nobody can guess it. unless the reports come out, right? I'm just saying, if you look at only the total number of people who passed, then majority and highest pass rates came from the Winspert. That is what I'm saying, right? So I hope that helps and gives you the clarity. And so, and then you know that every batch we bring something new, right? If you have been following us and if you have been attending our course previously also, every batch we bring something new on our course, something new on our program, improving the material, improving the preparation experience, improving the support system that we can provide to our candidates. So as we know that from last 2 years, we have been bringing the power notes, we have been bringing hot notes, then the mind maps came, then so many new mocks came. The first time we brought the entire TG mocks and the TG SBQ mocks. We were the first to bring the infection control guideline mocks, trauma guideline mocks, specific X-ray mocks, health promotion, ADA policy mocks. So those things, we have always been the pioneer to bring newer and newer preparation material and support system. And now with this batch also, like previously, we are bringing extremely new things. So the first thing that we are bringing for you is the winning edge files, where we have combined now the thousands and the past papers, eliminated the repeats, corrected them, upgraded them based on the newest concepts. And that is why, that is how we have prepared the winning edge Q bank for you. So every subject will be given their winning edge Q bank mocks, and per subject there will be about 4 to 5 mocks, so that they are not all together at one place, to make it enough number of questions for you to attempt at one given time. So winning edge Q bank will be provided for each subject. Operative is already published for this week, week 1, and so forth. The endodontics, the prosto, perio, every 8 subject will be published in the coming 1 or 2 weeks max. And these winning edge Q bank has been comprised of the basics, thousands and past papers combined together. We have eliminated the repeats, we have corrected the language, we have upgraded the references, and with each question of the mock, we have provided now the explanation. So every question has been given an explanation. So you don't have to now read any separate notes. You just solve the winning edge Q bank, and the explanation will be also provided to you when you solve the mocks, these ones. So you don't have to read separately any other notes for these. All your so as you know that study plan also includes 1,000 classes, right? But now they will also become optional for our busy candidates. I will touch more about that as well, how flexible you can make it, because now the 1,000 classes explanation, what I have covered in the thousands classes, explain the concept, right? It would be added to the winning edge Q bank. So those who don't have extra time, those who are busy professionals, busy parents, they can actually just read the explanation on the winning edge Q bank, and they don't really have to watch the 1,000 classes. But if you have time, I would still highly recommend to watch the 1,000 classes also, because the concept clearing will become easier for you from them. Okay, so that's one thing. Now the other new things that we are bringing is other than your winning edge Q bank in this session, in this batch, would be infection control guidelines mind maps. Because every single time in every examination, now that's an expert tip, and please remember that you will find newest questions from infection control guidelines on every exam. The repeats may not come as much. ICG is one source from which the newest questions come every single time. That is why, for your revision purpose and so that you don't miss even a single concept, we will give you infection control guideline mind maps and even additional newer mocks on ICG, so that you can practice newer questions from infection control guidelines. Goes without saying, as important as your therapeutic guidelines, similarly, your infection control guidelines are also important. Preeti, how to learn? See, unless you're practicing in Australia as a DA or you're working there, there is really any chance for people who are outside Australia to immediately apply it practically. That is why ICG is one thing where repetition and revision is the key, right? MMF power notes are also ready, Sirat, but again, they will not be given to you as files to read because we don't want to increase your burden or increase the content to read. So the MMF power notes have been added to the MMF mocks now. So when you solve the MMF UAF files or when you do the MMF mocks here, the explanation, the power notes of the MMF have been added to the quizzes now. So you can find all those explanations on the MMF mock. Very good question, Sirat. So even MMF explanation has been added. UAF explanation has been added on your power notes, and we will try to add that also as the explanation in the mocks also, right? Similarly, UAF2 mocks will also be released and created here. From those UF2 power notes, we will add that explanation also on the mocks so that when you're doing the mocks, you can simultaneously revise the explanations through the feedbacks. Okay. I'm so happy, Priyanka, that you liked the TG mocks, and UF1 and UF2, I'll talk about it, Divya. Okay, so the new things, let's focus on the new things. The ICG mind maps will be coming, the trauma guidelines mind maps will also be provided because again, trauma guidelines are also very volatile, right? And about 10-15 new questions every time, how the injuries look like. So newer picture of injuries we will provide to you, newer trauma guideline mocks we will provide to you, and then trauma guideline mind map so that in the end, in the last month, you can review all the important concepts under one page only. Now the ETG, as you know, there is no new fourth edition TG. There is no new TG, only the third edition. That is why you will continue to do the TG classes as usual on the program, as you can see here, right? You have therapeutic guideline classes under the program. Each week has dedicated every single day on the study plan. You have the designated TG class to watch. Along with that, the ETG, which has the updates, I will be covering the ETG newer chapters in our internal classes now. I have taken in the past some of the public sessions on the ETG chapters. If you are planning to join us now, and you haven't watched those, go to my Facebook page. You will find I've taken on bruxism, I've taken on trismus, and I've taken a lecture on the anxiety reduction, anxiety management in dentistry. Those three new ETG chapters, classes, and lectures I've already taken. But the rest of the remaining new chapters, which would be from our disability chapter, which is entirely new on ETG, then the obstructive sleep apnea chapter, which is entirely new on ETG. I will be covering those two absolutely new chapters purely on our internal classes. They will not be on the public sessions. So those who want to join and want to see how we are covering the newest ETG chapters, please watch the bruxism, trismus, and the anxiety management chapters and lectures that I have taken as public sessions, which is provided on our Facebook group, Facebook page as well. So that is about the ETG, which also will be the new part of this batch. The other thing and the most powerful tool I can say that I really am very proud that we could come up with an idea like that, because genuinely we were sitting together and we were talking about the fact that, we have, see, those people who are in the top 100, and this time, like the 100 candidates who cracked, of course the cutoffs were really high this time. So in previous exams, like in March 25, we had about close to 200 candidates, cracking it, around 170, 180 candidates that cleared through us. So in that time also we realized that the cutoffs were, slightly lower and the pass rates were high, but not as high as you would have found in March 24. right? So sometimes the pass rates, they do get lean. We don't know ADC how they decide how much pass rates they will decide for each batch, but when say about 200 people are passing with us, we know that 80% scorers will get there. Those who can score 80 plus marks, 80% plus scores, they can get through. But this September 25, I think, this is my just an estimate, that the pass rates were really low and the cutoffs were really high. So I think the candidates who got 90% plus marks in all the four sections or all the four clusters, they made it through. So the cutoffs were really high this time. And hopefully the March 26th, the cutoffs can be slightly lower and the pass rates can be slightly better. Just like after September 24, the March 25 came as a relaxing breather, right? Similarly, I'm anticipating the March 26th can also be a slight breather, but we can never be sure. And that is why this time onwards, from this time onwards, without expecting the examination, whether they're going to be repeats, whether they're going to be a lot of new questions, or there are going to be so many variations, no matter what the exam is, we cannot control it. Whatever the cutoffs be and whatever the pass rates be. From this moment on, if you have been in my course, you know that, right? I make you strive for 95%, right? Exactly. You know that, right? Every single class you will hear me, every single time you message me personally, I make you strive for 95%. But genuinely tell me, there are many candidates who don't listen to that advice, right? Sometimes they think even 80 is fine, right? Why not? Why not aim for the moon and then land among the stars? That is what we want to be, right? Aim for the A so that at least you can land a B. Isn't that right? Tell me. There have been moments, every single class I have emphasized, aim for 95%, aim for 95%. Like a broken record, I have gone on and on and on. That is why I say that for the times like these, when things can get unpredictable and the pass rates are beyond our control, that is where it comes handy. If you prepare for a 95% success and scoring, you are aiming for the moon and you will definitely land among the stars. Is everyone getting this message very loud and clear? Because it's an extremely important message which I have been giving to my students from last 8 years almost now. But it lands on some, it doesn't land on some. But this time I want majority of you to realize the importance of it, that yes, ADCs can sometimes take up 80-85% scorers, but when the percentages pass rates gets lean, it is the 95, it is those who were preparing for 95 plus, they will get across the finish line. Is it making sense for everyone? Give me yes or no's, at least that you can promise that. I know you might think right now, I'm scoring in 50s. How can I get to 95? I'm in 60s. How am I going to 95? I mean, I know there can be a, voice in your head, and especially, we have, the negative voices are sometimes louder. But you gotta shut that up. You gotta shut the negative voices. That yes, I may be at 50, but Jigs has a formula, and I will apply that, and I will reach that 95%. It's doable, and people have done it. I mean, if you watch the success celebration class, I don't know who talked about it. Vijaya, I guess, talked about it, that she was getting all in 90s. She cracked the exam. She was getting all in 90s. But the moment we threw the new TG mock and she dropped down to 75. So the lows and see the ups and downs, they happen. But your target, so always aim highest. Always aim highest. Because when you're aiming the highest, you will land, that is the B grade at least. So aim for the A grade. So A grade is 95% plus and B grade is 85% plus, if or 95 or 90, because this time there could have been very little gaps also between the grades. So B could be 90 plus and A could be 95 plus. But in other easier exams where the cutoffs are really low, then A could be 90 plus and B could be 85 plus or 80 plus, right? So we can't predict that. Can we predict how ADC will set the cutoff every time? Can we predict that? Tell me. Can you control that? How much will be the passing rate and how much will be the cutoffs? You have absolutely no control on that. And when you cannot control something, your best bet is to be the top cream of the lot. Simple. To be in the top score, 95% plus, because that lands you in the safest zone. In an unknown territory, always aim for the highest score. Is everyone with me on that? Are you feeling I three see Erica, sometimes you think that I did three or four wrong. Now, one thing is the variations could have gotten you, Erica. You got to accept what went wrong, because if you don't own that I did this wrong, you cannot improve it. Tell me one thing, can you improve and work on something unless you acknowledge it? Tell me, anyone here, can we improve and work on something unless we acknowledge it that it requires improvement? Erica, tell me, as a person in real life, can you work on something? Can you improve something unless you acknowledge that it requires improvement? And that is every time I tell my candidates who fail. When you own your success, learn to own your failures. That yes, I needed to know more. I needed to learn more and I needed to improve more, because unless the acknowledgement comes, you cannot work on it. Your brain will only work on something when you acknowledge that it requires work. So own your failures as gracefully as you will own your success. Exactly, Preeti. Good thing that you said you don't know how to rule out from variations in the options, and I am going to talk about it. And we are working. So, this time you don't even know the soft skills that we are adding, we are going to provide you with the soft skills to improve your success chances, to improve your performance. We are going to give you the strategies. We have that formula. We have had 4 A's candidates also on our group this time. So we know the formula. We will give you that secret sauce. Okay? That is what the inner circle calls are going to give you. We will bring more slots, more call slots, more consultants, more tutors. I'm going to train, give them the strategies, give them the secret sauce, and we are going to personally train you with that secret sauce. Right? This time, the inner circle calls, and we'll provide you the strategies personally, not just in the classes, because I have been saying those strategies in the classes, but I get it that not everybody is receiving that. That is why we will give you personalized calls to personalize, mentor you to success. Exactly, Mian. We will give you. So, inner circle is about how to go from C to B and from B to A. Okay, and also if you're at D, then from D to C, and then C to B, and then B to A. We will help you graduate by holding your hands very, very personally, because that's where Winspert is heading, right? That is where we want to help you at. Our job should not be to come, read few questions, give you A, B, C, D, and go and don't even care about. I have always provided you with references. I have always provided you with explanations. I have always discussed variations with you. I have identified the hot notes, hot topics from the exam, given you the combined material to read from that. Everything I've done for you so far also. But now I will continue to work more and more for your success and continue to support you more and more in this journey by actually helping you where you are personally, individually going wrong. Now the help will have to happen individually. That is what I'm seeing now. You need individual help. That is where me and my team will come in. We'll take that role up and we will support you even better. We are devising, we have devised the strategies using our program, using our plan, and to closely monitor your growth. And then when you're seeing yourself grow from 50 to 60 to 70, you would at least have a realistic expectation from your exam, right? So this time what happened is people who are more hurting are those who were in 80s because the cutoffs got really high and 90s only made it. If the cutoffs were in 80s, 200 of my candidates would have been passed. I guarantee you that. You all also know that in the group also, right? Sirat, everybody, Erica, you know that, right? We have been working so closely. We monitor each other's progress. We have been in touch together so much that we know that the 80s candidates have left out and they are the one who are hurting, right? The most. So now I want to tell them that, see, you could have gotten lucky and the cutoffs could have been higher, but that didn't happen. But that doesn't mean that you cannot now jump to 90s. You guys can take that 90s jump. And people who are in 70s and 80s, they will also have to take that jump. Everybody has to take that jump. And we will take that jump together. Okay? So inner circle calls will definitely help you score better, and we will start it from the first week itself. Meenakshi, when you book your inner circle call, our consultants, our tutors, they will guide you personally, even on the personal level of self doubt, because unless you eradicate the self doubt, you will not be able to perform better. So your performance is not just academic goal, it is also a personal goal. Academically, you may know a lot of things, but if you are in self doubt, if you are in that dark zone and not trusting yourself, you will never be able to give your best. You have to get out of that. You have to get out of your own head, right? Sometimes they say, no, get out of your own way, get out of your own head. You will have to learn to do that. You will have to let the light in you shine. The self doubt. Gabby, I will introduce the inner circle calls. I will announce, I will book, create the slots, the call slots and everything. And I will post the link for our enrolled students to book those slots. Okay, Preeti, yes, your question has been registered and I'm going to be talking about. Now, a lot of students, they also come and say that, you know what, we did the entire program, we watched all the classes, we read all the power notes, we did the hot notes, we did the mind maps, we did the mocks, we were getting 70%, 80%. No charges, Shivani. If you're enrolled with us, inner circle calls are absolutely part of your program now. There are no extra or any hidden charges on that. Okay. So if you're enrolled with us, they're part of the program. So sometimes what a lot of students have come to also say that, we did the program, we did the complete course and everything. So doing the whole course and watching the class and reading the notes just for the sake of it is not enough. It is not enough because in examination, the language of one option changes, one keyword in the history changes, and the entire answer changes. But your brain is not registering those changes. Why? Because you are not strong in concepts. This examination does require a lot of question practice, and that we provide to you in our program more than 5,000, 6,000 questions. The Mega Master file, the Ultimate Advanced File 1, the Ultimate Advanced File Volume 2, the Winning Edge Q banks. There are 4 huge, Q banks available for you. But that is mandatory to crack this exam for practice, but without the concepts being extremely clear and solid, just the question practice will not get you to 95 plus. Yes or no? 95 plus needs extreme question practice and extreme concept clarity. Understood or not? Memorizing is one thing, practicing questions is one thing, but if the concept is not clear, that if one keyword changes, how my answer is going to change. And if your reading skills are not strong, let me tell you, sometimes it boils down to very simplest of things. Some of you could be easily failing it because your reading and comprehension skills are weak. You know that? Can you realize that it could be something very simple as that your comprehension of one word which was changed and you didn't register it, you didn't comprehend it, could have costed you the entire SBQ. It is a reality check, guys. This time when we start, I don't want to sugarcoat anything. It is a tough examination. It requires all you got, and you got to give all you got. If you cannot, then people who are going to give it their everything, they will crack this. If you want to be on the other side of the screen on the success celebration class day, then definitely in these 5 6 months you gotta give it your all. And gotta give it your all doesn't mean just cramming the answers and watching the classes without making sense of the concept, without realizing, is my reading skill strong or not? When I read the question, am I noticing every single keyword or not? Because if you don't have that level of alertness and acumen and the concept clarity, that okay, if the drug history changes, my concept will change. If the medical history changes, then my concept will change. Purva, it may be enough for some, it may not be enough for some. Why? Because some people start already at a 70% knowledge. For them, it can be enough. But some people start at 50% knowledge. Not enough for them. You got my answer? Very honestly speaking, know where you're starting. Your baseline scores should be clear to you. Your baseline levels should be clear to you, and then set the realistic goals. That's what we say in life, right? Realistic goals, they're best to achieve, they're more achievable, right? So if I want you to get 95% concept clarity, right? If I want you to have a 95% concept clarity and you are only at 50%, either in the 5 months you give it your everything, or take like few more months and take the next intake examination. Does that make sense, Purva? Good, Sakshi, you're realizing it. Because now we are going to talk about every single problem. Erika, you can know your baseline knowledge by taking the Winning Edge Q Bank now. The Winning Edge Q Bank is all the basics of dentistry, right? So how will you answer the variations? These Winning Edge Q Banks will come in handy for variations. And if you don't have a personal one on one connection with me, your concepts will never be clear. Let me tell you that. Unless, yes, you have prepared for your postgraduate exams and you have done a lot of reading and your concepts are already strong. But if your concepts are at 50% and you're not having one on one doubt solving with me, those concepts will never be solved on the study buddy group. Can I be extremely brutally honest about that? Your concepts will never be cleared and never be solidified on the study buddy group. Study buddy group is important to discuss. Have your study partners there. Know that you're not alone in this journey. Practice questions. That is it. Concept clearing happens one on one on private messaging on WhatsApp with me. Did you listen to success celebration classes and people who were there, that how every single day they were bombarding me with doubts? All of them were happy and proud of the fact that they bombarded me with 30, 40 questions every single day. Why they did that? Why they didn't care about how many questions and doubts they were sending me on a daily basis? Because they were solving and clearing their concepts at that same moment when they arrived, not waiting for coming days. Yes, so overthinking happens when your concepts are not clear, Sakshi. If your concepts were clear, you would not be overthinking anyways. Let me promise you that. Overthinking you have to do. Overthinking is your defense mechanism because of the lack of the concept clarity. You know that? Overthinking is not a habit. Overthinking is your compensatory mechanism, because that you have to do because you're not solid in your concepts. Once you know confidently, this is what I want, this is the concept wants from me, this is the question wants from me, you will not waste your time overthinking because you have done the concept clearing during the preparation. So understood, everybody, just knowing that I've watched all the classes, done all the mocks, read all the notes is not enough unless your concepts are cleared and solidified, right? Just hold on to the chats on Zoom. I think 2, 3 messages went up. I have to read them. So hold on to more questions. Okay. So Nitya, what about the different answers? No, the answers are not different. The concepts are different. Sometimes students have sent us questions from UAF1 and UAF2 separately and say why the answers are different. See, there also we have again highlighted that one word changes and the answer changes. So, whenever there is a confusion, we always encourage you to have a healthy discussion with us. Nitya, that's not argument, that's not fights. That's a very healthy way to talk and discuss and get the concept clear. If you are not convinced, bring me all the references and ideas that you have. That is the best way to actually clear the concepts. You know that, Nitya? Why, ma'am? Why? Challenge me so that you challenge me and I can give you more information and you will end up learning more. Or you will end up proving me wrong. In both ways, you are the winner, right? Right, Nitya? When we have an healthy argument, either you will ask me more questions and I will reveal more information and you will end up learning more, or you will prove me wrong and then also you will end up getting that confidence and knowing more. Most of the times it's me, but yes, we are also now bringing tutors on our groups and our on our chats to continuously provide you more solutions in lesser time. How do you know that your concepts are cleared? Like for example, so Gabby, if your concepts were clear, you would be able to answer any variation. So how to make sure, Gabby, is when you're doing UF1 practice or UF2 practice, every single time when you're practicing every question, imagine the variations yourself. Go on the tangents yourself. What if this history was not given and that history was given? Can I answer then? What if that history is given and not that is not given? Then would my answer be, what would my answer be then? Understood, Gabby? That is one exercise, mental exercise. See, you don't have to worry who's answering it. I am answering or my team answers. It comes from, we have a common thinking bank. All the answers are coming through me from my references, right? Even on the group or on the private chats. Your doubts will be resolved and it would be one thinking bank only. The idea is for you to get your concepts cleared, right? Don't worry about who's responding to you. Have a one-on-one doubt support, which is not chat GPT and giving you vague answers, but a real person giving you links and screenshots and references, which I am providing to you or through them. You're getting your doubts solved personally, right? So, Gabby, you got your answer. How to self-attest yourself every time you take one question? Go on a tangent. Now, see, because the question bank is extremely vast, right? 5,000, 6,000 questions from winning bank, winning Q bank, winning edge, MMF, UAF1, UAF2. There is a lot of questions, right? In the exam, you will go and you will find that a lot of questions will feel familiar. Because even if UF2 is not getting asked, UF1 questions will be there. If UF1 doesn't come, MMF will be there. In MMF doesn't come, the questions are coming from the winning edge Q bank. That is how vast Winspert Q bank is. You all know that, right? So in exam, you will naturally feel that I have seen that question. Agreed or not? You will have that natural feeling. I have seen that question. Now, the moment you get that feeling that it's a familiar question, your guards should be up. That now I have to be more careful because now this question, I have one memorized possibility. But now this could be completely a variation. So you will anticipate a variation automatically. Understood? Would you do that for me, please? Anticipate the variations when you see familiar questions in exam. Right? Okay. So at this time, Nitya, we will start the UF2 discussion all again together. So you will get the time to build those concepts again. And Preeti, when I take all the classes of UF2, I have been doing that and I will continue to do that with by teaching the questions with variations. Okay? That is exactly how we have been doing, and we will continue to do that. Okay, with variations discussed during the live class. That brings me to the next point. Attend live classes. Now, thousands of students, and I see only 100 names on the live class. You don't want to attend live classes also, because I understand there are recordings for your help. So, recordings are there for your help in emergencies. But at least show up for the live classes, because why? Live classes give you that live engagement, and it will help you for concept clearing right away. Lot of students watch the live classes the next day, which is also good, which is also nice. If they are busy on that day of the live class, they can watch it the next day. That is exactly why I brought the concept of recordings, right? But there are some people I've noticed, they are not even watching any class, and they just go to the file, solved file, and that's where they want to learn from. Tell me anyone here honestly who can own that thing. I have noticed that. They will not attend live. They will not even watch the recording the next days. All they wait is the solved file on the drive, and they want to read the solved answers from the file. Don't be one of those people. Okay? Because if you do only solved files without listening to the explanations again, your concepts will not be built. And tell me, you have heard me say 95 plus target or not? Tell me, have you heard me say the 95 plus target or not? By all your honesty, you did not, you avoided that. You kind of ignored and thought that, maybe 80s are also enough, good enough. See, that could have helped on easier passing rates exam, right? That could have helped when the passing rates were a bit higher, 3 4 years before also, right? So now the UF2, I have taken off the older file, Erica, entirely, and we'll be doing it entirely new. So all the corrections will be discussed as the new file now. UF1 corrections are already there. And if required, any new concepts come up, the correction file will be upgraded. But that doesn't mean that if the updations are coming, you have to get nervous. You have to be bold, Erica. You have to accept that the the languages change, the references change. The 2019 links are something else, 2023 links are something else. The ADC sample paper come out, that changes your perspective, even despite having references, right? So you have to bold up now. Okay. And what I'm doing again is, Erica, in this 1 month only, I'm again reviewing MMF. I'm again reviewing UF1 for any further updations in the references, so that in the first month only I have the updations ready. And by the second month, you can start memorizing the newest concepts. Okay? That also. So you should be proud. One thing is that why still us? Why still 100 of us and others academies have to fake numbers and without even names? Why, even if 130 40 passed, and why still 100 from Winspert? Because of that in-depth updations, because of that updations that I do the hard work, that okay, this is 2019 link, let's bring the 2023 link or 2024 link, which is the closest to the exam. Once the file is done, no other academy goes to years back of questions also. I am dragging with me, updating the answers, reviving those questions, reviving the references. Other academies just meet every week, talk about few questions. I don't know where they get it from, whatever they do, just few questions every week and done. Look at the amount of Q bank, the depth and the width of the Q bank that we have, right? But then it also means that the updations will be required, because those questions have been coming from the past. Those who are reappearing, Gabby, you gotta be 95% plus. You gotta be there. This is not a random advice. This is the holy grail advice, Gabby. Get this in your system. You gotta be the cream of the lot. You got to beat people up in your knowledge. Not just in knowledge, in the concept clarity, the confidence that when you're sitting in the examination, no overthinking, no variation can get you. Right? So I'm owning it. A lot of my students must have gotten 80% or something. Those who got missed. I'm owning it. I'm telling you that we knew this batch, right? But look at the pass rates. Go ask other academies how many students passed with them and ask them for genuine names. They will not be able to provide more than 20 names. And why I can provide you 100 names, and you have been on group, you can go check their WhatsApp numbers and names and everything. They were with you and throughout the journey. That transparency speaks for the depth of the material, right? But yes, what if the pass rates are low? What can we do then? What if the cutoff is high? What can we do then? How can I make the people who are in 80s pass when the ADC is only picking the 90s one, right? But who got the most 90s? Winspert got the most 90s. In September 24, when only 100 people passed, 80, 90 were from Winspert. Who got 90s then yet again? Us, right? I'm not saying it's your fault that you were in 80s. I'm just saying we were not lucky enough that 80s also got picked this time, right? Exactly, Gabby. Improve. Be the best so that nobody can beat you. That's it, Gabby. Tell yourself, if this is what it takes to be the best, I will do that. That is it. No more being in that borderline zone. And for you, Gabby, I'm rooting. I'm rooting, you know it, right? For you and Simmer, I'm rooting for you guys. And I'm rooting for so many other students also who I know that are just there. And because of the low pass rates, they missed that finish line. Erica, I know you. I know your preparation. I know your hard work, everything. And I'm rooting for you guys, okay? But this time, when I say I want 95%, I want 95%. Is everyone with me on that? When I say show me up on 95%, there will be no shortcuts. See, ADC is simple, but a long route. It's not, there are no shortcuts. Why there are no shortcuts? You need daily interaction with me. Whether me or tutors, but on one, you need interaction. You need to get doubts sorted. Okay? Whoever is there answering your questions, there is somebody answering your questions. Be grateful for that. We'll have calls for you. We'll teach you personally on the calls. We'll answer your doubts personally. I'll bring tutors on the group also to answer your doubts on the study buddy group also, so that no confusion creates there. I will do everything to help you. But you also meet me. You also send doubts every day, no? Make that personal connection and solve your concepts. Have a strong concepts. Don't memorize. And don't memorize. Plus, don't try to avoid variations. Do not miss the live classes. Watch it live. So these are the certain strategies that I've given you now. Is everybody aligned? Now let's talk about the plan. Let's get the work done. Okay? So now here is the good news. The UF volume 2 is entirely ready. If you remember, it was 43 pages. It is 75 pages now. The UF volume 2 classes will begin from Wednesday, this Wednesday. Every week we will meet and we will do the classes on UF 2 on every Wednesday. Every Sunday, I will post a poster on the group telling you all the classes of the coming week. So can you see this is a 75-page file now? The newer concepts, the newer questions have been added to this. Okay? We're going to practice from the first page and the first question itself, everything again. All right? And with every single question, I'm going to be talking about every concept in depth. We'll show you the references, we'll give you the explanation, and we'll talk about the references and variations. Understood? I'll tell you about how single word changes can change your answers. Okay, dokie? Yes or no, please. Is everyone promising to be there on live classes and learn the concept building? And when you do the same technique, when you're practicing UF1 files and MMF files, the explanations are also getting added on the MMF. UAF power notes you already have. Winning Edge Q Bank also have been added the explanations. So many places you're reading the explanation, the concepts reading. It should build the concept, no? Or no? So don't think that 60% knowledge and 70% knowledge I can go with and crack this exam. Yes, maybe in 2021 you could have. 2022 also you could have. 2019 easily maybe when the pass rates were 40% up to 45%. These days the leaner pass rates, they might get better in the coming years or months. We don't know yet. If not, if we are set up for a tighter pass rates, let's prepare accordingly. If the bar is set high, would you jump the same? Or if the bar is set up high, you will prepare for a higher jump. Yes, UF volume will be same because Erica, it would get too much then to cover in the live classes, right? MMF, just like MMF, UF volume 1 is also same. The corrections are already there. But Erica, in within this month, I will revise the UF volume 1 corrections also if more are needed. Within 4 to 6 weeks, I will also update the UF volume 1 corrections. Okay? So that you have enough last 3 months to memorize the updates. But everybody, I don't want to see that whiny face why this answer got changed. Please, you gotta own up to it. It hurts me also. It is my job also. I have to revive on the correction file. I have to go and update on the drive. I have to go and announce on the group 20 times so that everybody gets it. It is more pain that I get 50 doubts on the same question and respond to that also, whether me or tutors. But it is hard for us also when the references change. Trust me, we don't get thrilled about it because we know that we have so many people to bring together on that. But you gotta own it. You gotta embrace it, that this is for my betterment. If the answer is getting updated, somebody is watching out for me, that how ADC is evolving, how the references are evolving. Somebody's out there watching out for me to ensure that the maximum passes and highest passes still be from the Winsperts. Okay, Erica, yes, you gotta embrace it. I want you all to be brave enough to embrace it. But this time I'll do it preferably within 6 to 8 weeks so that the last 12, 20, 14 weeks you can completely review it and set it in your solid memory. Okay? Mubaraka, why is it not on the study plan yet? Because I did not know how many pages will be because we were compiling the file, right? And because now the UF2 will be covered every week under the live class by me. So what I'll do is, now that I have the page numbers ready, I will add the revision of the UF2 file every week. From week 2 onwards, I will add on the study plan UF2 revision watch. So that one time you will watch live with me and then the next week you will watch it as per your study plan as revision. Okay, so it will also be transferred on the app. It will also be added to this PDF of the study plan. Then the UF volume 2 mocks will also be created. So from week 2 onwards, I will add the UF volume 2 revision mocks also. Then the power notes will also be created. So from week 2, I will add the UF volume 2 power notes reading also. So under read also I will add, under watch also I will add, and under assess also I will add, but from week 2 or 3. So that first week we are just starting out. From week 2nd or week 3rd, I will start adding the UF2 revisions. Understood, everybody? So UF Golale is Ultimate Advanced Files. MMF is Mega Master File. These are the names that we have given to different question bank compilations so that students know different reference names for each individual files. But they are all the collection of ADC relevant SBQs and QBank. We have the most vertically, horizontally, the widest QBank collection. Shraddha, this is the most important document, I cannot make it downloadable. You got to understand, you can write it down every week with your hand if you cannot write entire, but every week just write it down for yourself. Live classes also on the study plan, this plan. So they are added, no, Kushbu? All these classes that you see here, these are the important articles. You're talking about the Tuesday class and the tutor support classes also on the study plan. That would make it too confusing here. So tutor support classes, they are the revision classes, right? And then the my Tuesday public sessions, mm, you're gonna make it very hard looking for yourself if I do that. Okay, let me think on that. Okay, Kushbu, let me take that feedback. I'm gonna write it down how to add. I can consider adding the Tuesday session for revision, but cannot guarantee the tutor support classes. Tutor support, please go on the app and just watch from there. So now let's go to the app, everybody. Are you ready to take the tour now? Tanveer, the QBank winning edge operative has been added, and as I just showed you, I don't know you missed that or not. You saw that, but see this here section, the winning edge operative for the week 1 has been added. Okay, and it has also been added to your week 1 study plan. All right. So winning edge mocks have been added. Okay. Yes. Every day do one mock. Okay. Maria, every day do one mock as per your study plan. So now for your study plan, you have a watch, read and assess strategy which is given to you. Every day you are going to watch some classes, going to read some notes, and you're going to assess yourself on some mocks. Everything is mentioned on the study plan, what you should read that day, what you should assess that day, and what you should watch that day. Now the 1,000 classes are optional. People, those who are extremely busy, because winning edge q bank will have the explanations from these 1,000 classes, so that is optional now. But if you are a young graduate, recent graduate, and have all the time in the world, no kids to disturb you, and you have time in your day, I would recommend watching the 1,000 classes. They will open up your brain to another levels of knowledge. So Tanveer, from week 8 onwards, your weekly TG test will begin. Not from week 1, from week 8, your weekly therapeutic guidelines test begin. Okay? But not for the first few weeks, because first few 8 weeks, I want you to focus on individual subjects and reading the TG ones. Okay? Good suggestion, but I have planned it based on something that first 8 weeks you focus on subject wise preparation, and then from 8th week onwards you will start your weekly therapeutic guideline mock exams. Now one another good news, you all love ACUS TG classes, right? So from next Monday, everything that you do this week on TG, so this week, let's say first week you have had TG 1 to 7, 8 to 15. So till Sunday you did TG till page number 54. So now next week from Monday with Dr. Akers, you will start reviewing the previous week's TG task. Understood? Whatever you had to read on the first week, the 50 pages, she will help you revise the entire first week TG on the next week's Monday. That she will do every week. So what is it going on now? You will read it and watch it yourself. And on Monday, she will help you review everything. She'll take a kind of like a Viva also. So your entire week's TG gets revised. And whatever hot notes you read this week, you will revise it with your Kalai's class on the Sundays. Okay? So Kalai's class, you will revise your hot notes. Akis class, you will revise your TG. Tuesday, we will meet for new concept learning, concept building for public sessions. And then for Wednesdays, we will meet up for our UF2 classes, where we will apply the concepts, learn the variations, talk about the references, talk about the updations, see the keyword changes and learn the strategies, have our booster doses, how to solve such questions in exam. Separate revision for what, Suchitra? For which topic you're saying? So many revisions from week one alone, right? From week one, your TG starts getting revised, right? And then from then your hot notes start getting revised. Your UF2 also starts getting discussed. And with me Tuesdays, you get public sessions also. So everybody's understanding how the program is turning out, right? Everybody fully aware, oriented. Exactly, Nitya. Tutor support classes, one-on-one doubt solving. We will bring tutors on the group also. Then we'll have inner circle class calls for you personally to discuss your challenges, your scores, right? Yeah, we'll do the cleft lip, cleft palate. No big deal, Tanvir. One topic, one class, we'll get it done. Don't worry. Those are not the make and break of your results, right? Every time there will be a new topic in ADC that will become the hoo hoo ha ha. Oh, that came. Suture came. Cleft lip came, right? So Nitya, vaping also came. But you know what? What references I got? What feedback I got? Remember the vaping article that we did? Remember? We had the vaping hot notes also. Every single question that came was from that document. Every concept was there. Yes, Mubaraka. So two classes with me and two classes with tutors. One with Akers, two with me, and one with Kalai or Anj. Okay, Mubaraka? Got it? And apart from that, inner circle calls whenever you feel like it and the slots are available. Now, because it's a new feature, I will slowly see it, how many slots I have to make, how many people are booking, kind of that. So let me evolve that feature slowly. So don't get panicked if the slots get too filled too quickly. We might have to bring more slots then. So Preeti, we have the mocks for Carey's image management, clinical images. Somebody on the success celebrations also talked about that. That all the X-rays that they practice, they saw it in the exam. Who said? Ayman talked about it. Remember? So all the mocks are already there for practicing. It is up to you to give your 100% and embrace the program 100%, Preeti. Preeti, it's your first course with me, no? You were not there in the last. You're not repeating, right? You're not extension or you're not dual course. Sunday hot notes, Monday TG revision, Tuesday public session, Wednesday UF2 Purva. Every Sunday I will send you a poster of you're extending, right? So you have to now, Preeti, make sure you have to do all those mocks. That means you haven't explored the mocks deeply enough. Yes, exactly. That's your promise that is needed, huh? Everything is provided. It requires. So see, everything is on the platter served to you. Is it or is it not? Trust me. People are coming. I'm coming to give you concept classes. I'm coming to give you the UF2 classes. I'm giving you recording of other Q banks. I'm giving you explanations and feedbacks of other Q banks. I'm giving you power notes of my classes, hot notes of all the concepts one place, so you don't have to go one textbook to the other. Everything is served to you on the platter. Every mock has been created. X-ray mock, health promotion mock, ADA policy, trauma guideline, infection control guideline. So much so, 160 plus mocks. Now, everything has been provided and worked and worked and worked. What you have to do is work hard. Okay? Ruchita, there is no second plan for second time. Your thing is you do the same things, but you will do them faster. So you do them more. Ruchita, you need more depth. Work on your mistakes more. Ruchita, when you take mock, you still are not getting 95%. If you're still getting 80%, work on that 10%. Where it's lagging. Why you making those mistakes still? Why that concept is still not clear? Are you reading not correctly? Are you confused between the concepts? Are your concepts not clear? Are you not solving them with me? Identify the problem, book inner circle calls, and discuss with me, tutors, what's going wrong, how we can work on that. Understood? Everybody? Easy peasy, Sirat. So plan is clear. The week one, day one is here. You have all the mocks here. You have all the classes here under individual week plan, under the mocks also, and your documents are all here for all the mind maps, for all the hot notes, for all your power notes. Everything is there. UF2 power notes we have removed because we will now be creating again newest ones for the new UF2 with the newest references. Camilla, that is a challenge, of course, because see, if you were doing two dual course with me, then of course you can do little every day. But if you're planning to do it in 5 months, you have to dedicate 6 to 7 hours every day at least, Camilla, right? Because even if you eliminate watching the 1,000 classes, there are other mocks and reading that you still have to do, no? No, Deepika. Only the new joinees will start from week one, day one. Those who have joined me prior and they are going on week 3 or 4 or 5, wherever they are, they will continue on their own pace. Yes, tutor support class is live. I will remove the older tutor support classes from the app because now I kept it so far because I knew a lot of people were coming from the previous batch. They might have wanted that revision, so I kept it so far. You don't want me to repeat? A lot of you don't want me to. You want old classes there because if you are moving ahead, then you want them, right? Exactly the reason that me and Apurva also thought, let's keep it. Where was it? Where was it? Under the webinar. Tutor support September 25. So I'll keep it like this and I'll create a separate section, tutor support classes for the live March 26 batch. So that those who are from the older batch and they want to revise the hot notes of other subjects which are about to happen in this batch, at least you have the support classes there. Okay, so I'll keep it. And the live classes, the live tutor classes, I'll add under the live March 26 batch. You see the live 26 batch section? So the live public, then live internal, and then live tutor. Like this, we'll continue to add. 10 time mocks are more than enough. Within 3 or 4 times, you should know, Mubaraka, where you're going wrong. Okay? But Erica, if you get time, do show up for the live classes also with Kalai and Anj only because sometimes listening live gives you more interaction and more understanding and clarity. And you also kind of are more aware of, oh, really? I didn't know that. Right? So live is a different interactive experience, whatever the session, whatever the topic, right? So yeah, the program is all flexible. Thousands also I've made optional for you. If you're busy, leave them. But if you have time, watch them because now the 1,000 explanations will be part of the Winning Edge mock explanations. TG related questions will restart from day one, week one on WhatsApp groups. I can continue. We can have a discussion on that because a lot of new students are coming up. They would not know that they are ahead, and they would feel a little bit intimidated and overwhelmed if we are discussing far ahead into TG. I think we should start from the page one only. So those who have already done it, consider it as your revision, and those who are joining new, they will also feel comfortable. Okay. So it works best for both. So what we'll do, tutors and I will discuss, we will start from the first page again for all the TG questions so that the new students don't feel overwhelmed. Okay? Because we have to take everybody together and move so that everybody feels comfortable. Because on app, it doesn't matter who's at what level, who's watching what week. But on group, it matters that everybody stays together. Okay? Maria, there are two absolutely new chapters. Rest of the chapters have added information. So bruxism had added info, trismus had added info, anxiety had added info. Those three I've already covered. And there are absolutely two new chapters which I'll only cover internally in our internal classes. And then TMD also has new chapters. Oral mucosal chapters also has new information. So everything now from ETG I'll cover internally. Either internally, some entirely new chapters I'll cover internally. Those who are slight updates that I can do on Tuesday sessions. Nitya, what nothing changed on what? Sorry, I didn't get the first part of your question. Nothing changed where, Nitya? TG3 you will continue to read. ETG has updates and I'm covering them. Okay. So that I'll add to your live classes only, no? Here. No, you don't. It's a paid version, Gabby. And I'm giving you hot notes also on these. So on the lecture also I'll teach you, and hot notes also I'm giving you. Why do you need to buy the ETG separately? Consider it as an extended concept learning. Simple. Don't think too much. Whatever's coming, okay, this is extra information on bruxism on ETG. I have been given notes on this. I have been given a lecture on this. My job is to learn the concept and learn how to apply it to the question. Simple. In general, should we have to revise previous day's plans with today's? No, 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 Suchitra. That would be too much, because after week 10, you will see the program will go on self-revision mode. And see, now TG, whatever you're doing every Monday, ACUS will revise it with you. Hot notes that you read every day, every Sunday, Kalai will revise it with you. So why are you worrying when the tutors are there to revise everything with you? Even your revision is supported and tutored. So we are taking care of your revisions also, okay? And the UF2 classes that you will watch with me on Wednesday, next week I'll add it to the study plan under revision also. So UF2 classes also I'll add on the study plan. I will take care of it. When to add revision, you don't worry about revision. You worry about TG revisions. Because every day on our groups, you will be given TG questions. So continue to review and revise your TGs. Prerna, these are the ETG update lectures. So far, these three I have taken. Can you see it on my screen? It is under the live classes. Thank you, Mubaraka. So guys, I think I've covered mostly everything, but very important announcement that is coming is in this Saturday, we are having our October public mock. So if you have enrolled, you will get it on the app. If you have not enrolled with us, October public mock is coming this Saturday, and the discussion will happen on the Monday or Tuesday. I'll announce that when that happens. So be ready, and there is a special discount who has not enrolled with us, and they get the top 10 scores. The top 10 scorers of our October public mock will unlock a special discount for our course. So that's also coming up. And if you still are thinking whether to join the course or not, don't have to worry. You can follow us on our YouTube channel. You can follow us on our Facebook page and join our Facebook group, because every day there also I post an absolutely new and unseen pioneer SBQ from TG or trauma guidelines or from some other high yield source. So join our group, because even if you've not joined our course and if you want to prepare yourself, but there are pioneer SPQs that I post every day on our Facebook group. Hot notes, Jing, would be under the Winspert Smart Doc section. Jing, every notes, every document is under the Smart Doc section. You go there, you search by the keyword hot notes, and hot notes will show up. Jing, can you see on the screen? Prosto hot notes, ortho hot notes, all the hot notes will show up. Okay. H.O.T. Jane, can you see it now? Grisha, you can message my team on Facebook, or you can message me directly on my WhatsApp. My team is going to share my WhatsApp number or the Facebook page. I would request them again to share the information for people who want to join. But Jane, can you see it, right? So under the Smart Docs, all your hot notes are there, and the power notes also for UF1 explanation. When you watch the Ultimate Advanced File Volume 1, reading that power notes, you can search by power notes and you will get the UF1 power notes. MMF power notes are not as documents because I didn't want to give you so many documents to read. So what we did was MMF power notes we have added as mock explanation. Winning Edge QBank power notes also we have added as explanation, because I don't want to give you so many documents to read. Okay. So everybody understood my agenda behind, or what was the motive behind not giving the power notes of Winning Edge QBank files and MMF? Because I don't want too many files to read also. I want UF1 as power notes and UF2 as power notes, hot notes also as documents, but then MMF and Winning QBank, let's do as mock explanation only, right? So distribute the load so that you also don't feel overwhelmed. The public mock will be released on coming Saturday, Priyanka. You can jump to the winning edge mocks, but make sure when you jump to the winning edge QBank, you will make more mistakes and then you will learn from the explanation. But if you watch the classes and then take the QBank, then you will see higher scores, Priyanka, because of obvious reasons. You would have prior understanding. So it depends on your time and availability and your previous existing knowledge. If you think your subjects are weak, watch the classes, then take the winning edge QBank mocks. But if you think your knowledge is up to date, just jump to the QBank mocks. And if you have a lot of time, watch the classes. So this is the flexibility. I leave it at your own judgment. Hafsa, what part are you asking? You TG at least 5 times, ODEL at least 5 times, ICG at least 5 times, trauma guidelines at least 5 times. For enrolled candidates, it will be available till the exam. Yeah. So the team answered for you. Yes. All right, I guess I have covered most of the points. And if somebody has more questions, then ask me, ask away, and I'm available. So whenever you want to ask me anything after the class, and if your question, and see, if on WhatsApp you have not heard from me, please know that there is a lot of chat load. We are working on it. We'll get back to you. If you have enrolled and paid and everything and not been added to WhatsApp group, please wait. We are slowly adding everybody. Okay. Sandra, Winning Edge Q Bank is part of your week 1 plan. So open the study plan here and see the Q Bank, which day which you have to do, and start doing that day simultaneously. Okay, Sandra? So first week is operative. I'll edit that also. I'll put operative 1, 2, 3, 4, then endo also next week, prosto next week, right? So yeah, guys, that is it. I think it gave you a lot of insight, some reality check. Own your failures as much as you own your success. Get out of your head, get out of your own way. Personally ask doubts, concept clearing, the most important basic to crack ADC. Do not mug up the answers. No matter how many times you practice the questions, always when practicing, think about the variations, think about the tangents that the question can take in the exam. Okay, and then there is more and more and more. We will talk about that every UF2 class. I will give you this booster dose. Yes, Suchitra, operative 1 is added, endo will be added today. And then in the next 2 weeks, all the subjects will be added one by one. Okay? No, 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 no. Timings will change, Ramona. From tomorrow, we'll have at 8 p.m. 8 p.m. Sydney because of the daylight saving. So we'll go 8 p.m. now instead of 7:30, Ramona. We don't have a class tomorrow. We don't have a class tomorrow this week. Now straight we meet on Wednesday for UAF Volume 2 first session 8 p.m. I will post a poster in few hours, Ramona. I will put the poster on the group. Okay? Thank you so much. All right. Thank you guys and have a great, great evening. Thank you so much for being here. Thank you for showing up. And I really wish you all the best for your journey. God bless you all. May God be with you and bless you with success in your all dreams. Thank you. Thank you so much, guys. Thank you. Have a great day. Bye.